Let's get real, raw, and right now as we dive into the grief that's unfolding in our daily lives. I'm Christine Nederlanden, an expert in grief and bereavement trauma, and this is Grief Unfiltered, a space where we navigate our present grief day by day. Hello, everyone. I am tuning in from Mount Sinai Hospital here in Toronto, Ontario. I want to give a huge shout out to Mount Sinai Hospital, not only for taking care of my loved one who's having surgery today, but also for providing this beautiful synagogue, essentially prayer room, for me to be able to talk to you. Today, I want to talk about 5 things we should consider when taking our loved one for surgery. Let's just dive in. So, to give you a little bit of a backstory, I'm here with a family member who's getting surgery. And what I started to think about was anticipatory grief. And anticipatory grief doesn't always mean an imminent death. Sometimes we're just anticipating things, and this is causing grief on the system, emotionally, physically, and spiritually. So, the very first thing we're going to talk about is logistics. So, number one is logistics. How are we going to get to the hospital? What times do we need to be there? What medications do we need to bring? So, with logistics, we first want to talk about that travel time. Once we get all these little things organized with this, we came up the day before, we decided to spend the day here and sleep over. Little tidbit of information which I did not know: the hotels near the hospitals, and it is for most of the hotels and most of the hospitals, they provide a stay for people who are getting surgery, and it is much cheaper. So, the Delta Chelsea, thank you so very much for the cheaper stay, the great service. They even have transportation from their hotels to your hospital. So logistics are huge. Why are they huge? Again, you are stressing out. I bet you are. And when we have it down on paper, not only do you, but your family member, essentially the patient, is being able to see it all down on paper. And that reassures you that things are going to be okay and you're organized. Number two, I think this is one of the things that doesn't often happen, but needs to happen. Don't be afraid to bring in pen and paper to the pre-op, to the doctor's appointments, and don't be afraid to talk to your family member openly and say, what would you like? And, in this instance, it was, are we going to have anesthetic to put you to sleep? Are we going to get a blocker? And, what are we going to do? What are your plans? Similar to birth, what are you anticipating and what are our options, so that when your loved one or patient is in the bed and they start talking about what we're going to do, you have a clear idea of what's going to take place and what their wishes are. So don't be afraid. I know so many times, I just think we think, well, they know best. But really, who knows best is you. You're the loved one, you're the family member, and you've taken the time to talk to your loved one and ask what they really want. Of course, we have to be able to be flexible. Try to talk about all options, because we want to be flexible in that sometimes we have to take a little bit of a turn, or the surgery it is postponed. I had to call the day before to confirm time, and our time was changed. So once we have the logistics and we have that ability to write things down, not be afraid to go into those appointments with pen and paper. That's majorly what I'm saying with number two. Be able to walk in with pen and paper and write down your questions. That's especially important in a pre-op, because that's when you're going to have to talk about all of past surgeries, all of the medications you're possibly taking. That's a lot. So you really want to be prepared at that moment. A lot of times, for myself, because I've been in this position quite a bit, I love to print out the forms that I submitted, so that when the patient or your loved one is sitting there answering the questions because they reviewed them, you can actually follow along. So it makes things much easier. Number three, make sure you have food. I think so many times when we are in stressful situations and we're grieving, we forget about the food. I don't know how many times I've been stuck in one spot, went up to a vending machine to buy a bottle of water, and unfortunately it's $5.25. I know that sounds insane when we're looking at the bigger picture, which is your loved one is in surgery. But in times like this, it's so nice to have a bag with you that's got some water in it. So you're not running around looking for that vending machine. A light snack, something to read. These are all things that keep you and your loved one, um, fed. And so many times you keep running to that coffee shop. I know there's Tim's usually, or Starbucks, or a coffee shop within most hospitals, but you end up filling up on caffeine or juices. It's always nice to bring some water with you, have some fresh fruit with you, and offer it to your loved one if they can eat. I know it's hard when you've been told you can't eat for you're going into surgery. So be respectful of that, and try to stay away from bringing cookies and things like that. We tend to, when we're stressing, go for those sugary foods right away. Right? It's filling that need that we have. And then we go into number 4. This one, I know that a lot of times we want to avoid anticipatory grief. Um, we often think about it as anticipating someone is dying. That is not actually what anticipatory grief is solely about. It's anticipating something. When you're anticipating a major surgery for your loved one, not only is the patient stressing out and scared and wanting answers, and it's really that fear of the unknown. Often I talk about the fear of the unknown when we're talking about funerals and experiencing them. And really, it falls here too. When we talk about anticipatory grief, we're talking about anticipating something that we really don't know what's going to happen, and that becomes really, really hard. That just instills fear. So that's why when you look back to having all the logistics in mind, making sure you're well fed and having right on you some water and some fresh fruit, and then having that ability to not be afraid to ask questions and write things down so you have a clear understanding of them. When you get to this number 4, you're looking at the emotional well-being of not only the patient, but you, of me. I have to tell you, I've been here, well, since Tuesday, and today is Thursday, and I plan on staying for a couple more days. And you know, I recognize that this is tough. And I talk about it from an emotional perspective. Of course, there's that rearranging your schedule, and being able to fit all this in, and the children, and it goes right down to doing your laundry. But I know before leaving that I made sure the car had enough gas and winter washer fluid and all these things. So there's a lot of planning that goes into it. But when you're here and present, that planning really comes into effect. Because I'm not worried. I know the car has enough gas in it. I knew we didn't have to drive in a snowstorm. I have my bag packed right now, which has got some fresh food and water in it. And I know that I have my booklet with all my questions and everything. And my loved one, who essentially is the patient's wishes for when surgery is done and they're in a recovery. So the emotional well-being part of it, you just want to check in. You just want to check in not only with the patient, saying, how are you feeling about this? Do you have any questions? And you don't want to, you want to be there as support and advocate, but you also want to give them the ability to make choices, the ability to go yes or no, and respect that. I know that's hard. Sometimes, we think, for myself, I would rather be put out than, with us anesthetic, be put under and have a surgery done. But that's not the wishes of everybody. So you also have to take into the doctor's wishes for that. What is safe? What is not safe? So there's a lot of emotional responses that are going to come, not only from the patient, but also from you. And to recognize that this is anticipatory grief for you too. It's a roller coaster. One minute you're excited because you got in for surgery. We all know what that's like, waiting and waiting. And then you're there and you're worried about what if, what if, what if. So it's really important to acknowledge the emotions. It's important to allow them to be present, but also understand when we really have to logically pull together and go, what's medically correct? And, number five, and I think that so many times we we don't really, at the end of a day like today, where someone's having major surgery, and I have been prepping and prepping and prepping for weeks, if not months. After that loved one is in recovery and everything is okay, you assume you and your loved one will just go, oh, it's like this release from the body, mind, and spirit of, whew, we made it. Is to take that time and recognize that and know that you had the strength to do that. And talk to your patient, your loved one, and be like, hey, we did it. We made it. And now we're in recovery. And even though that anticipatory grief can take over, where you feel sick to your stomach, you have anxiety, you're scared, and you're rightly so. But when we really put it all together, when we have number one, the logistics, number two, being able to have that book and write down all your questions and concerns and don't feel silly doing it. Number three, make sure you have some food with you and being able to, it just saves you so much time and it helps you think clearer. We've all been hangry. So that's the last thing you want to have when you're advocating for something. Number four, recognizing the emotional toll on you and your loved one as the patient. And number five, it's kind of like the end where you're capable of going, we made it. We made it through the part that we were so frightened of. And now's recovery. And however that looks, being able to look at your loved one as the patient and say, you did good. You did really good. I know this was hard. Acknowledge that pain, acknowledge the grief that things have changed, that they've experienced something that they may have not expected to experience, but also with grief and also with these challenges in life, where do we end up? Resilience. This is a time to embrace resilience. It always amazes me how people recognize the strength within. We often experience something that is grief ridden. And when we make it through, we go, wow, I did it. And that resilience shines. So being able to embrace the aftercare and know that recovery may be a long road, but together you're going to make it. And together you're going to laugh again. None of these journeys are meant to be taken alone. We're here to advocate and carry each other, walk with each other. So I just wanted to pop in and be able to share this with you. And I really feel like there's so many of you out there that we don't recognize the grief we're experiencing when we're advocating for our loved ones during a time that, we're helping them make major decisions for surgery. So, again, tuning in from Mount Sinai Hospital in Toronto in a snowstorm, and just so happy that myself and my loved one have made it to the hospital, and I'm hoping for recovery. So thanks for tuning in, everybody. And I hope this helps you. And thank you again for all your love and support. Take care.